Everybody, thank you so much for your patience with us. This platform is somewhat new to me. I've been to events on it. Running it from the back end is a little crazy, and my internet and sound is a little wonky. So hopefully all will go smoothly moving forward. We are here with Dr. Aimee, who I love her name. It's the Egg Whisperer. And we all want healthy eggs here. We all want to know a little bit more about egg quality and egg health. She has some incredible information on her social media and on her website, eggwhisperer.com. And she actually has an amazing podcast. She also is a very close friend, I think best friend of my doctor and my medical advisor, Dr. Deyigarte. So she introduced me to her. I'm so excited to have her. And Dr. Aimee, we're going to hop in with some questions for you. If anybody has questions in the audience, please drop them in the chat and we'll try to get to them after we get through the bulk of our questions here. How are you, Dr. Aimee?
I'm doing great. I'm glad we figured this out. It was easy.
Me too. Okay, so we're here to talk about egg health. You are our egg guru. So we are going to jump in and talk about gauging the health and quality of someone's eggs as they begin treatment. How is that done? What does that look like from the medical perspective and the patient perspective?
Yeah, so fertility doctors are really rap artists, honestly. We drop the AFC, the AMH, the FSH, the E2. I mean, that's really what it's all about. I mean, if I had another career, I would be a DJ and I would be rapping all day long. But that's literally like what people have to know. That it's all about your age, your FSH estradiol drawn on cycle day number 3. Your AMH can literally be any time. And then your AFC, which is the count of the little tiny fluid-filled sacs that contain eggs in your ovaries. We take all that information together and we put together your fertility song and tell you a story. And so it's super important that you find a doctor that will tell you that story from the very beginning. So that's kind of how it's done.
So let me ask you, and this is a little off book, but I recently had a user call with someone who felt that she didn't really get the full story from her OBGYN prior to seeing an RE. Do you think it's necessary to see an RE to really get your full song? Or is that something that your gynecologist can do prior to seeing a specialist?
OBGYNs are awesome. They're really happy, patient people, right? But they didn't go to school to help people get pregnant. So think about it this way. If you had a heart attack, would you run to your family practice doctor? You would run to the cardiologist. So when it comes to fertility challenges, especially in fertility education, I am obviously biased, but I do think a fertility specialist is the way to go. OBGYNs have about 2 weeks of training. It depends on when they went to school. If you think about it, things have changed so much with training as far as how many hours a resident can work in a given week, and the amount of IVF fertility exposure an OBGYN grad gets right now, it's minimal. So I would say that you actually probably know, my IVF patients probably know more than their OBGYN about fertility. And that's no joke. And I imagine you probably, and a lot of people out there can probably agree. So that's kind of my recommendation and analogy I give to people as far as you can go right to the fertility specialist. Think of fertility as a heart attack of your uterus, and you want to run right to the specialist from the very beginning.
That's a great way to look at it. And I think you're right. I think a lot of patients, the learning curve is steep though, when they come in, but they do end up, I think, at the end of the process, knowing a lot more probably than their gynecologist. When it comes to your patients preparing for IVF from an overall standpoint, holistically, as well as medically, how do you suggest that they undertake that? Just getting ready fully.
Yeah, I mean, I think the most important thing is to figure out what your diagnosis is and really dissect it, and don't allow anyone to use the word unexplained with you. Just be like, okay, that's really nice, but like, I'm not buying that. I have patients that are like, I'm 43 years old and they told me it was unexplained. I'm like, huh? Like, who would ever say that? So it's really important to ask your doctor, what have you ruled out for me lately? Like literally, you can sing it if you want, but that's one question to ask. So your doctor can literally go through everything that they know about you. And then if they still say it's unexplained, then you say, what are the possible explanations in this situation? And then you want to ask, what can I do that's in my control to give myself the best chance for pregnancy. Even if you need IVF, you still want to be, just like you said, fully prepared. So it could be supporting egg health with supplements, sperm health with supplements, looking at your lifestyle by focusing on diet and exercise and mindfulness and stress reducing activities. Like those are the kinds of things that I talk to my patients about, like building your fertility team, your posse, and making sure that you've done everything in your control so you don't look back and say, damn it, like, why didn't I know that we needed ICSI? Right? Like that would be really annoying if you find out afterwards that you should have done it and didn't because you didn't know the diagnosis because someone told you it was unexplained, but the motility was low the whole time.
And you brought up ICSI. If we have some time, I want to get to that at the end, actually, because I talked to Dr. D about something about that last night, the podcast that you two did. What are some ways that you suggest increasing egg quality?
So looking at your body, I'm not a body size person. It's more like your metabolic parameters. So if you are on the curvier side, look at things like your hemoglobin A1C, your cholesterol level, your blood pressure, your glucose, and try and fix it all up. And if it means having to lose a little bit of weight, do it. However, if that's really hard for you, the diet and exercise stuff, no worries. There are medications that can also help you. So that's one recommendation. Look at the medications that you're taking. Not only that, but also guys sometimes can be taking things that could be fertilization blockers, like calcium channel blockers. Even some guys, you would think that they would know in 2020 that testosterone kills sperm. Look at that too. And if your guy's on testosterone, get him to stop. Actually, you disappeared on me.
Uh-oh. I can still see you. Can you see me now?
Yeah.
Okay.
Yeah. So the other thing is look at cannabis. Most of my patients, we're in California right now. My out-of-state patients, they're not doing this, but I feel like my California patients, like 90% are smoking weed. And I'm just like, not right now. Avoid things like cigarettes, heavy alcohol drinking, and you know, the supplements like CoQ10, a good prenatal with fish oil. Those are the kinds of things that I recommend to my patients to support egg and sperm health.
Okay. Is there any specific prenatal, just I'm sure somebody's thinking that you recommend?
Yeah, I mean, I love Theranatal, THERANATAL from Theralogics. And anyone who is listening to me and wants a code, the PRC code for a discount is Tushy, all caps, TUSHY. So that's a good prenatal. It has everything that I just mentioned except the CoQ10. And then you can get their Neo Q10 as well.
Awesome. So this is a bit more in depth, and try to follow along with us, guys, that are not familiar with kind of the backstage part of IVF. But how directly does egg quality affect the quality of the embryos that are created once the egg is fertilized? How does that feed in? Absolutely. So the age of the egg has everything to do with the likelihood of an embryo being genetically normal. Certainly sperm quality also does matter, but I can take someone's age and then predict what their IVF pyramid will look like. So I have something on my website. You can go to the blog search engine in my Draimee, DRAIMEE.org website, print out that pyramid and take it to your doctor. Your pyramid will change based on your age. So age is the most important predictor of pregnancy chances and pregnancy rates. And when it comes to IVF, it's also really, really important. So I'll give you an analogy. A 30-year-old, 5 eggs, each egg probably has, I don't know, a 45% chance of being genetically normal. 40-year-old, 5 eggs, each egg has a 10% chance of being genetically normal. So it's huge. So that's why I always tell people, try and get pregnant as young as you can and secure options for yourself. And I have all these egg whisperer golden rules, like freeze your eggs by 32 or embryos if you're partnered. If you're 37, consider going right to IVF, especially if you want 2 kids and don't already have 1 at home. Okay. What are some must-ask questions for your REI? So when you go in, I think a lot of people just really don't know what to ask. So they're kind of spitballing, and I think it prolongs the process just because they're not getting all the information. And like we said, the learning curve is pretty steep. So what are maybe a few questions that you want to make sure that you ask your doctor if you're starting fertility treatment? What are you needing to know right out of the gate? I think the most important thing is, what is my diagnosis? What protocol are you using for me and why? What are my IVF options and what is best for me?
And will what you're doing for me help me reach my family size goals? Why or why not? So I think if you ask those questions at the very beginning, I think it will help you kind of create a sort of roadmap for your future fertility success. And if you don't know those answers, I can tell you, if you do an IVF cycle and it doesn't work, then you're going to start asking those questions. And I think the time to ask those questions is from the start of your IVF cycle.
Absolutely. And we are coming up on the end, but I want to ask you this one because I think it's important. If you had to give a single sentence of advice to a woman facing this process, what would it be?
Your mental health is the most important thing when going through IVF. So it's really important to address that from the very beginning. Patients ask me all the time, Dr. Aimee, will I get cancer from this treatment? Well, what kind of long-term effects can I expect? And I'm like, no, but there's a really high chance that you might come out of this feeling really depressed and anxious, and you might have PTSD. And I don't want to do that to people. So I keep talking about fertility team, your fertility posse, find a therapist, online groups, have a whole group of people that are cheering you on from the very beginning. That really helps.
And I will add, that is the purpose of Claire. That is what we do. So filling in the gap there and kind of being the resource for mental and emotional wellness during the process of IVF. In terms of women with no knowledge of this process, what do you think they're most surprised to find out? And if they're, even at the other end looking back, what has been the most surprising thing for a lot of women, a lot of your patients?
Well, not so much a lot of my patients, because I talk a lot, as you can tell. But I think in general, I think people think that they can wait and do IVF when they're 40 years old and it's just going to work. And IVF is the thing that they do at the very, very end when nothing else is working. So I think people are surprised that when they do IVF, it doesn't work the first time. So that's why I tell people the 3 questions: what do you want? What is it going to take? And are you willing to do it? So if you're 40 years old, it could take even 4 to 6 cycles to get one healthy embryo. That's something you should know from the very beginning. So those are the conversations that I have with people, so they don't feel like they were misled or didn't have all the information they needed to make the right decisions for themselves.
Absolutely. Dr. Aimee, thank you so much. I want to see if there have been any questions. Oh, there have. Great. So someone asked here, what are your thoughts on assisted hatching?
Well, assisted hatching is great. It can increase implantation rates, and we do it in every single PGT case. You cannot not do assisted hatching if you're doing an embryo biopsy for genetic analysis of the embryos. It's just like saying, you can remove my appendix, but I don't want surgery. It's possible. Okay. So I have patients who are like, I read about assisted hatching, I don't want to do it. I'm like, you're doing it. Like, there's no option. That's how they actually do the embryo biopsy. They do assisted hatching. So, so it is something that's done standard, very safely with a laser. In the old days, we used to use a needle, and in some cases that would destroy the embryo, but we don't destroy embryos anymore by doing assisted hatching.
Fantastic. Are there any, Toyin asked, what is ICSI? And I will let you explain that.
ICSI is basically a process of picking out one very sparkly sperm cell to inject into an egg. So it's just a way of fertilizing an egg. It's used in cases, for example, where you don't have that many eggs, or the sperm count is low, or if a woman is older. There are a lot of great ways that ICSI can help somebody. But in general, if you're doing genetic testing of your embryos, we almost always choose ICSI because that's something that makes the process a little bit easier on the embryologist. And at the end of the day, they're like the most specialized pediatric surgeons. We want to make sure they have everything they need to make our embryos sparkle too.
Makes perfect sense. And one other thing, you have talked a lot about age, and we have a session later today about becoming a mom after 40. Some people have trouble, some people don't. And I know that has a lot to do with genetics, but what advice are you giving to your patients who are 40 or older and, are looking to expand their family?
Absolutely. I think it's really important to be as aggressive as you feel comfortable being as soon as possible. And I also, throw out pearls like plan B is sometimes the plan that was meant to be, and you don't need to use your own DNA to be a mom. And people get to that point at different times. And I tell people it's okay to keep trying, but if you're not making mature eggs, if they're not fertilizing, you don't have any blasts, it's time to just accept the reality and stop being a patient. Just turn that around and let's talk about really creative ways of being parents. There's so many awesome ways of doing that nowadays. And I just tell people, you're normal. It is normal to be 40 and not be able to get pregnant with your own eggs. 40 is when menopause starts. That's literally not an abnormal age for menopause to begin. And when you run out of your healthy eggs, you don't run out of the desire to be a mom. And I just think supporting people, understanding where they're coming from, making sure that their priorities are your doctor's priorities is always number one for me, and something that you need to make sure your doctor has in mind as well.
Absolutely. And for those of you interested in what she's mentioning about just kind of expanding your thoughts on being, how you're expanding your family, we do have a session called The Evolution of Family about third-party assisted reproduction featuring Dr. Eyvazzadeh a little later today. If you already froze your eggs and did not take the supplements beforehand, should you start over is a question here.
No, supplements are just like part of my special sauce. It's not something necessarily that should make you feel shame that you should go back and do things again. They may or may not help, but it's something that's in our control that could potentially help the eggs, but they may not. I recommend CoQ10 to every single person I meet until they're done having their kids. So it might mean that taking it just for a month or two before your IVF cycle or your egg freezing cycle might not have ever made a difference in the end, but it's just something that you can do that might help.
Yes.
So don't feel bad. Don't feel bad at all.
Great. Are there any more questions? Oh, I'm sorry. Is the age of the male sperm of concern?
It absolutely is. As men get older, there are increased risks of things like autism, ADD, ADHD, and schizophrenia. We know from studies that men over the age of 50 have partners that have a higher risk of miscarriages. So that means their sperm cells have a higher likelihood of being chromosomally normal as well. So absolutely, it's the same thing. Like when I have a couple, let's say they get pregnant with IUI, and I'm like, guys, like, you know, you're 42 right now. You just got pregnant with IUI. If you want another baby in a few years, let's freeze that sperm now. It's so much easier to freeze sperm than eggs.
Perfect. Wonderful. There's one final question, and then we have to wrap up. It is, what's your view on DHEA?
My view is it's not for everyone. And raised testosterone, I've seen it cause cysts. I've seen people get really bad pimples, a mustache, and a deepening of the voice.
It broke me out so badly, I stopped.
Yeah, I think it can be poison. I don't like DHEA. I do think that in some cases it might be helpful, but typically I recommend it for women with a follicle count that's less than 5, with a normal or low normal testosterone level. Otherwise, I don't recommend it.
Okay, great. And Dr. Eyvazzadeh chimed in and said DHEA can help in women who have a low ovarian reserve. This is what you just said, which is probably why you guys are best friends.
That's true.
Thank you, everybody. Thank you, Dr. Aimee. This will be recorded and it will live on our site as well as our YouTube channel. So you can come back and reference this. I will be sure to drop all of Dr. Aimee's information and the things that she mentioned into our social media as well. Thank you so much, Dr. Aimee. I appreciate you.
Thanks, guys. Thank you for all you're doing.
Thanks, everyone.
Bye.
So we're going to get ready in a few minutes for the next session, but those are actually breakouts. So Amherst Davidson is going to be doing the, later gator, which is for women who are not certain what motherhood's going to look like for them with aging fertility. The other breakout session with Andrea Joy is probably not going to happen. She's having really difficult internet issues today, and she reached out to me earlier. So we were trying to troubleshoot, but I don't think that we're going to be able to overcome those. So unfortunately, I apologize for everyone who wanted to be in that secondary infertility session. It is probably not going to happen. However, you can slip on over at 12:50 for later gator, and that's a roundtable session, just so everybody understands. Amherst will be moderating, and I think it's up to 8 people can also be on camera and be in the conversation, but it's just a max of those people. So it's kind of first come, first serve. So if you want to join in that roundtable discussion, then you should hop over there as soon as possible so that you can have that discussion. And then we will be back on the main stage with Home for the Holidays at 1:25 with Dr. Tanya Wood and Mandy Owen. I'm super excited about that one. So we'll see you back here at that time. Thanks, everybody.